Hi, everyone. Thank you for joining our office hours today. Let's go ahead and get started. Welcome. In partnership with Health Services Advisory Group and as part of the Train the Trainer workshop series for skilled nursing facility educators, the Department of Public Health in California, Healthcare Associated Infections Program presents today's office hours to review a CNA training implementation strategies. I'm Sophie Frank, a health educator with the CDPH HAI program, and I work with Project First Line. I'm joined today by my two colleagues, Shannon Melanzak and Shantala Hanya. Say hello. A few housekeeping reminders for today's office hours. This session is being recorded. We will post a copy of the recording plus the slides from today on our Train the Trainer webpage. This is an open and safe space for sharing ideas, so we invite you to ask questions, share your experiences, and discuss any facility-specific barriers, concerns, and successes you have with implementing CNA training among your staff. What you share might help or inspire others who are experiencing something similar. We encourage you to type any questions or comments into the chat or raise your hand and unmute during the discussion. We will compile an anonymized Q&A document and post it on the Train the Trainer workshop works resource page as well for your reference. As an educator in your facility, you should understand IPC prevention concepts specific to CNA, assess and reassess staff IPC training needs, be familiar with available IPC training materials and tools for CNA, and provide IPC prevention training to CNA. As a review, in last week's Train the Trainer workshops, we reviewed CNA IPC curriculum and training methods. We discussed methods to assess and reassess staff IPC training needs, such as adherence monitoring and feedback, and we navigated the CNA toolkit and the implementation guide. So today is really an opportunity to expand upon last week's workshops. We have some guest panelists today who are joining us in some discussion and how they implemented CNA training programs in their facility. We'll talk through some case scenarios, engage in an activity, and host a discussion where we'll review some frequently asked questions from last week's workshops. We'll have some time for questions at the end as well, and we'll wrap up with some next steps. I invite Shantala Ahanya, IP, to introduce our panelists and lead our panel discussion. Thanks, Shantala. Oh, I think you're muted, Shantala. No worries.
Oh, I'm so sorry. I'm talking about, okay. Thank you, Sophie. It's my pleasure to introduce our panelists who graciously agreed to be here on this day to go over their experiences, share their experiences, their success stories, and their barriers. So let me introduce Yen Teo. She's an IP from Dinuba Healthcare, and she's joined by Alejandra and Lily. So you can hear both from the IP perspective as well as from the frontline perspective, their experiences, their success story, or whatever the barriers they have. And Maria Nepersky, so she's our Vice President and Infection Prevention Control Program for Rockport Healthcare Services. So we can hear from a leadership perspective how she's able to support the facilities and how you can reach out to your leadership for better understanding your program. With that, we can welcome for both of you. And next slide, Joe. So, Yen, this question is for you, and then I will pass it on to Maria. Yen, how did you develop your IPC training program for CNAs? Did you use your the CDC guideline or CDPH guideline, if you can share?
Yes. Good morning, everyone. We develop our training program based on CDC guidelines. And we have our resource team as well says to create a program. So, and we involve our CNAs, all our CNAs, but to voice out their concerns if there's any issues on the floor in terms terms of infection control. That way, CNA spends more time at the bedsides with the residents, and they are more familiar with what's going on the floor. So we always make sure we listen to.
I think we are having some issues with Yen's volume, her voice. Yeah.
Let me use my phone.
Go ahead, Yen. Can you share again?
Okay. Yes. So we develop our training program based on CDC guidelines. And here at the Inuba, we have a research team who helps us creating our services, our policies and procedures, our training. So they are very helpful with that. And of course, we also involve our CNAs by encouraging them to raise their questions, to voice their concerns, or if there are any challenges or issues with infection control that we don't see on our end. That way we can incorporate it to our training program. So I know CNA spends more time at the bedside, so we always make sure we listen to their concerns.
Thank you, and that's a great way to create a focus group. Maria, from your perspective, so yeah, from the leadership perspective, how do you support the facilities who are struggling or who are trying to implement the program?
Well, thank you, Shantala. Well, first of all, in order to establish a program, I meet virtually with all of my centers monthly. And those centers that need more intensive support, I can support them by meeting with them. I also have a senior regional partner who travels to those centers and can support them with boots on the ground. So when we have the opportunity to support those centers both in-house and when they need it, just in time, we will do that. We both have an open door policy, so they can contact us at any time and we are available to them. So if they have questions about training, if they need tools for training, if they have questions about the curriculum, they can contact either Monica or myself to be able to ask questions, be able to ask for development ideas. And we always encourage them and make sure that they understand the concept. And we always keep it resident centered, make sure they understand what the real purpose is of what we're doing.
Thank you, Maria. So I'm going to add one more question to you, Maria. So I know it's from the leadership perspective you're looking at. So your program is always based upon the CDC or from the Rockport Healthcare. Are you looking at a different aspect too?
I personally, I'm familiar with using multiple nationally recognized evidence-based practice. So I pull from CDC, I pull from APIC, I pull from SHE. I also pull from CMS, but I also look at the fact that we have a lot of different entities locally that we have to meet criteria from. So a lot of times when I'm working with my facilities, I also remind them that you have to look at state and local practice. So we have some facilities that are doing things slightly different based on the county or local healthcare agency they're working with. So things like LA County, Alameda County, even Long Beach, they're doing things differently. So I sometimes have to juggle and remember who I'm working with. So we have sometimes a broader scale and sometimes a more focused type of scale, depending on which facilities we're working with. So when I tell them, I always remind them, even our policy state or local guidelines, because, when we're teaching, 75 facilities on how to create a program, we have to keep that in mind. So we tell them this is the overview, this is the broad picture, but you have to remember to go back to your locality and say, hey, okay, but our guidelines are more strict, so this is what we have to do, and then that's how they tailor their program. So we always look at a lot of the guidelines that are out there. I don't just focus on one. We look at everything and kind of make sure, what lines up, what doesn't line up, what is the best practice based on all those guidelines, and we incorporate them into our practices.
Thank you, Maria. Thank you for sharing that. With that, we'll go to the second question. So how do you prepare your CNAs to implement evidence-based practices? Yeah, I know you talked about your focus group, and can you explain a little more or expand more on how do you prepare your CNAs?
Okay, so we prepare our staffs with the IPC practices by doing in services and skills competencies. So we have an infection control orientation upon hire, which includes the hand hygiene, the PPE donning and doffing. We go over the disinfection, urinary catheter care, all the precautions, the sharp safety. And after hiring, we do an annual and as needed. So we continue to train our staff by using we do have a sniff clinic. It's a website wherein all the employees are being registered, and we send in services virtually, and there will be a post test at the end. So after they complete it, they get a certificate, and they get paid for their in services as well, which encourage our employees to do their in services. So yeah.
So I know we have Lily and Alejandra with you, right? So
Yes.
how, if they can say something about how it's been useful for them from the frontline staff going through the training, that'll be great if they can share their experience.
Hi, this is Alejandra, and yes, going through the training, the donning and doffing, the reminding of the hand washing, the different techniques, it's been very useful working with COVID patients, throughout this whole time.
So with that, anytime, so there is an update, you brought up a good point with the COVID, so you're able to, anytime there is a change in the practice, change in the guidance, so you're able to go to that your website and then go through the training and learn from it and making sure that they have a competency.
Yes.
Okay, so that's great to hear. And how do you have, anytime if there is a barrier, so are you able to come back to Yen and to discuss about the challenges, what you guys are going through, or you just follow?
Yeah, if we have challenges, we always refer to Yen just for more guidance, for better explanations, because sometimes learning stuff, being a visual learner is easier for me as opposed to learning something online. I'd rather go to Yen if I need more clarifications and have her explain it to me step by step as to what to do.
Thank you so much, Alejandra. Thank you. So as I said, like you did bring up our next how Shannon is going to go further about the type of training. With that, Maria, so how do you, since as you mentioned, so you have so many facilities in the different counties and different needs. So how do you prepare? How does your facilities prepare for CNAs?
Well, first, I support the IPs and the DSDs who are doing the training in those facilities. And the first thing we talk about is that we have to keep it resident-centered. So they often hear me say that they don't live in our workplace, we work in their home. So we have to keep it focused that way. And at first I've only been with Rockport for a year, so I don't think a lot of them still know how to take my personality. But a lot of the things that we're doing are things that they've not used to have. They've not used to having the support that they've had. So we talk about how we're going to put forth this program. We don't just talk about what to do. We talk about why we're doing it. We talk about the purpose. We talk about including, the resident is the focus, but it's like an onion. There's so many layers to care that we can't forget about the resident's family. We can't forget about the fact that when you take care of a resident, you're also taking care of their family, their visitors, everybody else that are included. And when we come across things like barriers, because including residents and families, truly, that's still something we need to work on in this environment, especially in our company. we talk about what our barriers are, and I include them in the solution. I mean, I don't want to make those decisions for them when they're the people who have the boots on the ground that are in the facilities. And if it's something that we can't overcome, I can take it to my clinical ops team and discuss it and say, these are what they brought to me. Is this something feasible that I can move forward with to try to help them overcome these barriers? Do we have these resources? And I like to elicit responses from my frontline staff. I like to hear what they have to say, because a lot of times I get my best ideas from my CNAs, from my nurses, about how to handle those situations, because they're the ones doing it all the time. So I listen, I take notes. I find out what the best practices are in their facilities. And sometimes when they say, well, we've always done it this way, I say, well, you know what? Maybe it's time we do it a different way. How about we try something else? You know, and maybe break out of that same mold that we've been doing. Because I like to do things fun. I like to do things innovative. I like to make things less monotonous for our staff. And kind of make them look through a different lens when we're doing these things. So when I prepare my IPs, I try to give them ideas to kind of break them out of that, oh, we're going to just do in-servicing. Well, maybe we don't just have to do in-servicing. Maybe we can empower our staff. Maybe we can get our CNAs to train other CNAs, do an in-service for other CNAs. Maybe we can get our nurses to do training for other nurses. You know, that they don't get just because your title says you're one thing doesn't mean that's the only thing you do. So I try to encourage growth professionally in all of them. And I try to make sure that everybody is involved in the solution, not just leadership.
Thank you, Maria. With that, I'll go to the third question, what we have, and then I'll start with you, Maria, since to continuation of what you just mentioned. So I know you have provided the training. So like how you have engaged your staff on training. So how do you engage your CNAs to ensuring the IPC practice are implemented without compromising the resident-centered care? For example, you may have staff who have been there for longer than just you, as you said, you just started last year. So you have from past 10 years or 15 years, they are there, and they are not going to go through the same training because they've already had the training. How do you engage those CNAs, as well as how do you make sure that they have a good IPC practice?
Well, first of all, you know, besides the usual things where we use the HAI monitoring tools and competencies, there are a couple of programs that I've kind of brought with me that I've done in the past. And one of the ones that I use is called the Honeybee program. And a couple of my facilities have really embraced this, and they love it because it's fun. And I explained to them, you know, have you ever seen what a honeybee does, especially like for PPE wear? How the honeybee goes from flower to flower to flower, and it picks up pollen and it drops off pollen, and then it goes back to the hive to take the nectar, but it's also taking all that pollen with it. Well, I had a couple of facilities that were doing very poorly with PPE wear, and we discussed this concept, and they totally got into this. You know, I talked about how we're the honeybees in the facility. And if we don't wear PPE correctly, we're picking up germs here and we're taking them to another patient. And then we're dropping off germs and we're picking them up. And our hive may be the nurse's station. It could be the employee break room. It could be the lobby. We don't know, but we don't see that ball of stuff that's on the back of the honeybee's leg. Well, this facility, when it just totally, I mean, I was so proud of them because they turned their practice around. They had a sign on the nurse's station that says, "Welcome to the beehive." They gave honeybee stickers to people who were doing it correctly. Instead of it saying, "You're a bad bee," they said, "You're a good doobie." And they really had a good time. So I'm actually in the process now of developing it as a company-wide program because the honeybee is an excellent example of how germs are spread from person to person, just like pollen is spread from flower to flower. And please feel free, folks, to steal that example because it's the perfect way to teach staff because they get it. It's simple, it's easy to understand, and it's fun. You know, and as a matter of fact, you can turn it into a competition. How many honeybees do you have on your facility unit today? You know, so we do things like that. We engage them. And you know what? They start pointing out people going, "Ah, you're being a honeybee, you know, and because they're like, you're going to ruin it for us. We want to win, you know. And because the IPs are patrolling and they're looking on their daily rounds to see who is performing correctly. And they're also stopping and congratulating those people with honeybee stickers. So it's not you're doing it wrong. It's, hey, congratulations, you did a fantastic job. You're wearing a honeybee sticker. So it's not that negative reinforcement, it's positive reinforcement. So these are one of the ways that we do it. And one of the programs that I've tried in a couple of the buildings that I've used in my past life. And they've really enjoyed it. You know, and not only that, you know, we really like to take the way things have always been done in SNF, and I like to turn it upside down. So that's always been me. So doing fun things like that, letting them know that what they're doing is important to what you know, the safety, you know, we fall under the umbrella of patient safety and infection control, and the safety and well-being of those patients falls into our frontline caregivers' hands. Really, they spend the most time with those patients. And I always like to start off my trainings too with them, say, if you take your hand and you take your patient's life and you put it here, that's exactly what's happening. So, you know, I really want them to embrace the fact that they are responsible for the lives of these patients, and everything we do has a potential impact. So when we do training, you know, there are a lot of things. We have many layers of training. We have an education department that I work with, but you know, it's one thing to sit in front of a computer, but it's another thing. Like I do virtual rounds in my buildings, and I'll say, can you take me over to that nursing assistant over there and say, hey, how you doing? Can you tell me how you do this? Or I stop and say, hey, can you put with it? Say, hi, it's me. And they're like, oh, hi, how you doing, Maria? I'm like, I want to thank you for what you did. That was fantastic practice. And I just want to thank you. And they're not used to hearing that all the time. So, you know, I try to bug people a lot, no pun intended, you know, but I also like to do innovative and fun things because, you know, I believe in humor in practice. And I believe that the more you play along the way, you increase their productivity. So that's where I come from as a leader. And I believe if you love your staff, they love you back. So that's how I keep them engaged in their practice. And I also try to do the same thing with my IPs, so they do the same thing with their CNAs.
Thank you, Maria. I think it's the great point. What you said is connecting with your staff, right? Yes, we can provide so many education. You can day in, day out, you can make them sit in the classroom setting, but are we connecting with at their level to understand and also appreciate that? Yan, the same question for you. How do you engage after providing the training to ensure the IPC practices are implemented at your facility by the CNAs after the training? Do you do that? Go ahead.
Yes. So we do daily rounding and observations by myself, the DO and the DSD, and we actually involve our other managers like our MDS, our social service, our activity directors, the IDT team to help us, you know, do the adherence and making sure observing our staff. So we make sure everyone is doing good hand hygiene, especially during meals, during passing out their trays, making sure they're bagging those soiled linens, clothing, and yeah, so we involve everyone with daily rounding and observation. And we also have some posters everywhere. So we have for all the things, we have a posters for hand hygiene, for the sanitizer dispensers, we have a poster of how to hand rub. And we actually started working with HSAG regarding UTI prevention projects. So we printed out posters and put it all the restrooms and showers about UTI prevention bundle. That way it reminds our staff.
Thank you, Yan. And I'm going to pull Alejandra and Lily, like if we can share from the frontline staff perspective, is there anything you think as a CNA working on the floor, what's the best way for an IP to engage the frontline staff? Alejandra, can you come out of mute?
Yeah, so the best way to engage with our IP is like she goes out there, she does rounds, she makes sure that we know what we're doing, we're able to ask her questions. She'll kind of do like a pop quiz and pull us aside how do you don? How do you doff? Like, how do you wash your hands? How long do you wash your hands for?
She passed out.
And then there is a new paper that she passed out to, us managers being department heads about hand hygiene, just making sure that our staff are currently washing their hands or frequently washing their hands before care, after care. If their hands get dirty or soiled, also their sanitizers. So she's involved a lot in different things and likes to go around and giving pop quizzes to the staff when we're working the floor too.
So you guys like the pop quiz when she comes doing the rounds versus sitting in so what's the best thing you like about Yan when she comes on the floor?
Surprises you.
She surprises you for one.
Yes.
And then she makes sure, like, without scolding you, like if you're doing something wrong or if you need more education, you can always ask her and she can always educate you. She'll pull you aside and
She makes us feel comfortable.
yeah.
Yes. We could actually go to her and ask her questions.
That's great. That's great. So that you're really engaging and then you're able to go to her for any concerns or if you don't understand. So that's a great way of communication. With that, I will go to the last question for our panelist. So Maria, what are your plans to sustain your successful program? Because it's like you have so many things going on at your facility. So now what's your plan to sustain this successful program?
Well, we actually meet as clinical leadership, and then we have meetings on a monthly basis with the DONs and the administrators from the facilities. And we talk to them about what's going on in facilities, what is important for them to continue, what is not. Again, going back to, when I was a DSD, I have to be honest with you, I used to put roller skates, fairy wings on and have a basket of candy and stop and say, what does RACE stand for? What does PASS stand for? And they thought I was crazy, but it worked, and that's where I came from. So, I use the 3-legged stool model when I talk to my center leadership. You've got 2 different stools in your facility. You've got one that's your DON, you've got your administrator, and your IP for infection control that holds that one stool up. And then you've got another one that's your leadership, your residents, and then you've got your staff. And I tell them that each leg is one of those. And if one of those gets wobbly or doesn't hold up their end of what they need to do, then the stool falls down. And then you get a collapse, whether it's your processes, your quality measures, your quality of care. And they have to remember that those 3 legs work in tandem. They work together, not opposing each other. And they have to start getting it. They have to start working together like that. So, not to say that our residents are furniture or anything. I'm not saying that. I'm just saying that with that model, the 3-legged stool model, that's how we can achieve success in those facilities. And the same thing applies to the program with leadership support, with the IP dedication, and with the buy-in from the staff as that particular model. This is how this program will be sustained. We don't want our CNAs to think, oh God, it's another education program. We want our CNAs to understand this is a means to improve the quality of care for our residents, which in turn helps us give better care, helps us be better at what we do. It helps us grow professionally, not it's just another training program. We have to kind of shift the focus when we're doing training. It's, there's a lot of stuff that we get thrown at a lot of times. And right now in our company, we're doing joint commission preparation. We're doing Project Frontline. We're doing the CLM LTC leadership training. There's a lot of things I've gotten us into since I started. People are like, okay, put the brakes on. I'm like, no. Opportunities need to be seized and opportunities need to be taken. Because a lot of times, when we're kind of been working in our silo, we're comfortable there. Well, we need to start breaking that comfort level. And we need to, especially with our frontline staff, start focusing on where the rubber meets the road. So, what we need to do is look at, what can we do? What programs, do we need to look at? On my end, I'm looking at what programs need to be developed to improve that care as far as the area of infection prevention and control. And then who are the key players that I need to focus on? From there, I work with my IPs. Like I said, I meet monthly virtually with my IPs, and this is the first time they've had that. And the feedback I'm getting is it's very positive. They enjoy it. We go over policies and procedures. We review the training. We actually talk about our Project First Line modules every month. And we talk about bits and pieces. We talk about enhanced standard precautions. And they're able to ask questions. They're able to throw things out there. It's a forum they've never had before. So by doing that, it's supporting them in order to be able to keep going with these programs, to keep getting ideas on how they can best support their staff, their CNAs, and keep realizing that this is not just a one and done. This is a perpetual program, because we don't just have CNAs that are there and that's it. We're not in a box. We hire people constantly, and that's basically one of our common barriers or challenges is staff turnover. And I'm sure there are a lot of facilities out there that have the same challenge. So we can't just say, oh, we did this training a month ago and that's it. Everybody should know it. We have to continually make sure it's on our calendar, make it a conscious decision to do it repeatedly on our calendar so that we know that we're constantly rounding with that in mind, we're teaching with that in mind, and that we're supporting and answering questions. And if we have someone who's struggling, that we focus on that and that we make sure it's a supportive focus, not a punitive one.
Thank you so much, Maria, for sharing from the leadership perspective for your organization.
You're welcome.
Yen, what are your plans to sustain your CNA successful adherence to IPC practices in your facility?
So as an IP, we will definitely continue within services, skills, competencies, daily rounding, providing them with, a positive feedback. And we will probably definitely adopt the Honeybee program, and we will continue on. Yes, we will do annual training and continue to involve the residents.
Thank you
and
so much.
CNA. Yes.
Thank you so much, Yen. Thank you so much, Maria, for sharing your success and barriers with everyone on this call. And it's going to be an ongoing. With that, I will pass it on to the presentation to Shannon.
Thank you so much, Shantala. And thank you so much, Maria and Yen. I loved hearing the analogies with the Honeybee program and, the onion in relation to the different levels of patient care. It's just wonderful. I feel like the two themes I heard from both of you was empowerment and thinking outside of the box with your facilities, which is great. It seems like it's really successful. So thank you. We're now going to look at two case scenarios that could occur at your facility and really want everyone to just think about how you could respond to support staff's IPC knowledge and implementation. Let's look at the first one. So while conducting your daily IPC rounds, you observe a CNA taking vitals in a 3-bed occupancy room without changing their gloves between resident care areas and without cleaning the equipment between use. What are your next steps following the observation? Feel free to add your responses in the chat. So there are multiple steps following the observation you can implement. For instance, you can stop the staff. Next slide. You can stop the staff and provide a just-in-time training. Like we mentioned in last week's webinar, key messages from the curriculum can be made available in different formats to share with your staff in a just-in-time training situation. You might pull the individual staff aside to review key IPC concepts, or you might also bring in nearby staff for an impromptu group review. In this situation, you could reinforce the importance of proper hand hygiene and cleaning and disinfecting reusable devices. You can also conduct adherence monitoring to identify the training needs. Through adherence monitoring, you can identify gaps or areas of improvement that staff may have in IPC implementation. This can be done on the individual or broader level and at a frequency that best meets your facility's needs. You can also provide feedback and to improve compliance by making your staff aware that there are areas for improvement. Feedback also allows for you to get a better understanding of the reasoning behind why a gap may exist, and in turn, more effectively find solutions. You can also evaluate if the staff has access to the tools needed to perform IPC practices in order to get a better understanding behind the reasoning behind why proper IPC implementation may not be occurring. Does anyone have any other steps you think can be taken to address the observation? Once again, feel free to add in the chat or come off mute. I'm seeing some in the chat already. Training skills, on-the-spot training, stopping staff immediately and educating, wonderful. Providing feedback in a constructive manner, not punitive way. That's great. All right, let's move on to case scenario number 2. So it's late in the afternoon, you receive a call from the admitting person regarding an admission to a room which was previously occupied by a resident with IV fluids and a central line. When you do your room readiness rounding, you see the IV pump with IV fluid bags still hanging on the IV pole. When asked, CNA staff reply, "I thought EVS cleans the IV pump." What is your response? Feel free to add in the chat. Okay, so there are multiple ways you can respond. For example, next slide. You can review equipment cleaning policy to ensure the responsibilities are well defined. Having the policy accessible can allow your staff to review at their own time as well. You also can conduct adherence monitoring to identify opportunities to improve room cleaning and disinfection compliance. Through adherence monitoring, you're able to obtain data to see if there are gaps in IPC implementation and in turn provide feedback to staff. You can also review the compliance data with the nursing leadership and work collaboratively to identify areas of improvement as well as finding solutions. Can anyone think of any other responses that could occur, or what type of training you could utilize to support IPC understanding? Feel free to add in the chat. I see someone put educate. It's great. Thinking back to last week's webinar, what type of training you could utilize as well. If anyone has any ideas, feel free to add. An all staff meeting, I see in the chat. Wonderful. Yes. Yes, these are great ideas. When looking at this scenario specifically, you could use Module 3's training material that reviews CNA's roles in environmental cleaning to educate and empower your staff. In doing so, you can remind your staff that CNAs can take initiative to clean and disinfect areas versus only reporting them to EVS to handle. So we're now going to do an activity. We'll navigate the online toolkit to address questions we might get from our CNA. Let's use the toolkit website to find resources to help us answer the questions. Feel free to follow along as we do this. Erin's going to also be putting the questions in the chat.
All right, so I'll talk through these screenshots really quick, and then basically we're going to be doing the live demo of the website, which I'm really excited to show you. We're going to go to the CDPH page for Project First Line, and then we will, sorry, my Zoom is being wonky, navigate to the toolkit. So can everyone see my screen? Oops, my PowerPoint is right.
Yes.
Okay, great. Okay, so here we are in the Healthcare Associated Infections Program, and then within it, Project First Line, which brings you this toolkit. So we're going to implement the Project First Line toolkit for CNA and click this link on the home page. It'll open in a new tab. And then here is the toolkit that we discussed so much last week. So you may recognize this image from our screenshots during the presentation. We have sections on how to use it, how to plan your curriculum, and then the implementation guide is that PDF version that I was talking about, and you can download that and have that as a resource ready to go if you forget the website or if you just prefer to work with a file. And that has additional suggestions on how to implement. The web version is a little bit more brief. And then down here is the training modules table that we definitely discussed and you may be familiar with looking at from the screenshots. So I'm gonna pass it to Shannon and she's gonna walk us through some questions and we'll see if maybe we can answer them using the toolkit.
Thanks so much, Sophie. So once again, Erin's going to be putting those questions in the chat and we'll just look at the modules here and see which module we think is going to be the resource to answer those questions. So let's look at the first one. It's lunchtime and you're doing your rounds. The staff is passing the meal tray to a resident with gloved hands and proceeds to assist another resident with feeding using the same gloves. Can the CNA wear the same gloves with each resident? Where would you look for resources to answer this question? Feel free to add in the chat which module, as we're looking at the screen here, you think we would use for a resource to educate staff and reference. PPE, perfect. I see someone already said PPE, which would be module 2. Yep, standard precautions. That's definitely another one we could do, PPE. Great. Great. Well, why don't we jump into module 2 and see which slides we might want to use to address this. Sophie's just going to scroll through, and feel free to add in the chat which slides you think would answer this question and you might want to utilize with your CNA staff. Looks like it's taking a second to load. But module 2 is a great module. You could review this module with your staff to make sure they have a solid understanding of PPE use practices, and later on, maybe using module 5 to expand upon PPE use when feeding specifically. All right. So as we're scrolling through, feel free to add in the chat which slides you think would be a good reference tool. Maybe we could print this out, make it into a poster, badge buddy. So I'm thinking we're going to print this do's and don'ts of glove use. Sophie, do you want to go ahead and show how we would print that?
Sure thing. Okay, so it's kind of a small icon, but you go up here to print this file. I'll click that and hope it'll open a little subscreen. You can also save it as a PDF. What I'll do here is go to Pages and do Custom. And then I believe, Shannon, was slide 15.
Yes.
Fabulous.
Perfect.
And I would either save it as a PDF or I could print it directly.
Wonderful. So once you printed this, once again, you could make it as a handout, you could make it into a poster, even a badge buddy, just for staff to reference, just to have available as a training tool. All right, let's move on to activity number 2. That's going to be put in the chat as well. So you keep getting questions from your CNA about what PPE to wear when taking a resident to the shower room. Where would you look for resources to answer these questions? Once again, shout out, feel free to come off mute or put in the chat which module you guys think would be best as a resource tool for this. Module 2, module 7, I'm seeing in the chat, PPE, wonderful. So why don't we look at module 7, which reviews bathing and dressing specifically. Module 2, I think, could work as well. All right, we'll give it a second to load. And once again, just let's look through the slides here and see which slides you think would be best to print out or present to your staff, maybe use in a quick huddle setting. Right. All right, we're scrolling through. All right, so why don't we, I'm not seeing in the chat, feel free to add in which slides. Maybe we can go a little more slowly, Sophie, if you don't mind.
Sorry, just
No
enthusiastic.
worries. No worries. All right, so these are all great tools we could use. I'm thinking, why don't we print slide 31? You don't mind going up?
Oh, 30. Oh, okay.
Or 13, I believe. Keep going. Keep going. I think it's right here, that personal protective equipment, PPE. So once again, just another tool you could print out. So we'll go to the print. And once you print that, it could also be a badge buddy. You could also present this and then expand upon it in your training, whether it's a huddle or just-in-time training. Just a great slide to really show and expand upon within the presenter notes and your own knowledge on PPE use during bathing and showering. Okay, so why don't we move to activity number 3? That'll go into the chat. A CNA is caring for a resident with diabetes and needs to provide nail care. The CNAs ask you what tools they should use to perform this activity. Where would you look for resources to answer this question? I'm seeing module 4. Someone put module 8. Seeing another module 8 in the chat. Great. Thank you all for participating and making this engaging. So why don't we look at module 8, nail care and shaving? And we can look to see which slides you guys think would really answer this question specifically.
And I just want to note, Shannon, that we're looking at a PDF version here, which is great for printing, especially if you want to do several. But we also have the PowerPoint versions available with the scripts. So we got it all.
Thank you, Sophie. So I think this slide right here would be great. Slide number 9, just
Okay.
showing the process for fingernail care. That would be, I love the visuals on here. I don't know if you guys do as well, but I think for visual learners, this would be great. Once again, would be a great badge buddy. And then any other slides as we go through this that you guys think would be a good learning tool? I'm seeing people are not specific slides, but feel free to call out in the turn off mute and say this one. This could also be a great one. Why don't we use nail clippers? Just to reinforce the recommendation to not use nail clippers and why. It expands upon that within the instructor script and presenter script notes. So why don't we try to print that one? Why don't we use nail clippers?
Great. And I think slides 9 and 10 too, we liked, right?
Yes.
So if I'm printing multiple pages, I just separate with commas, and then you can print these all out. And if you wanted to hand them out too, you could just do multiple copies.
Amazing. Thank you, Sophie. So I hope this helped kind of navigate the toolkit once more and how you could use these reference tools and resources to really help with your training to your staff. We're now going to move on to a discussion. And once again, great participation. Shantala is going to lead us through this discussion and answer some of the questions we received last week. And Joel, if you don't mind sharing your screen again from here, that would be appreciated. Thank you all.
Thank you, Shannon, for the great presentation and navigating the toolkit and then giving them the different tools of how they can provide the training to the frontline staff. With that, I think the first question we have received several questions. The couple of them we are going to address today is, what's the guidance on food temperature when serving meal tray? And also, can I reheat the food? So then those questions came up, and we did reach out to our licensing and certification and other guidelines. So the information what we received was, you had to follow the food safety code to meet the required temperature, and when you're plating it, right? So then there is a different guideline. So you had to follow when you're preparing the food, right? So then at the time of when it is a warm food, like what's the temperature versus when you're plating it. So plating, there is you really need to work with your nutrition department to make sure it's not too hot, it's not too cold. So we need to make sure the residents are able to, they should like the food, right? So it's food needs to be palatable. So need to make sure that it is it's not too hot. If there is any concern regarding the temperature, make sure that you follow up with your nutrition department. And can they reheat the food? I think it all depends upon, again, you follow your facility policy, what your facility policy will say. And again, looking at the temperature, so what can be reheated. There is no, again, you have to really follow your food code per your facility policy. That's what the regulations will be looking at. Next question. Are CNAs allowed to sign temperature log for resident refrigerator? So again, we were able to gather some information. There is no clear restrictions that the CNAs cannot, but they had to make sure the CNAs have received the training. The first and foremost, the question comes up from them when the surveyors are in your building is whether the refrigerator is inside the resident room or whether the refrigerator is at the nursing station. So you had to look at what is your policy says to manage those refrigerators. So especially when there is the range is, if there is, if it is out of range, what is the next step? So you really need to have a policy in your facility and how you're going to manage. And the CNAs can do it. There is no restriction that they cannot check the, sign the temperature log, but you really need to make sure that, do they know what to do when it is out of range, and whom do they need to report? Do they need to report to the IPs or the facility person or the kitchen, and what do they do with the food, right? So those are all the things you really need to specify and provide the training to your staff and have a competency. And if you have done everything, and you should, the CNAs can do the, they can log the temperature, temperature log. They can sign the temperature log, sorry. Did we had any other question, Joe? Do we had, I think that's about the questions we had received. And then some of the questions Shannon already addressed during the presentation. And if feel free to come off of mute. And if you have any questions for us to provide guidance. I don't hear anybody coming off of mute. Questions in the chat?
I'm not seeing anything in the chat. Feel free to unmute yourself or add any questions in the chat. We'd love to respond to any questions you have and share with everyone else. It's all a learning experience.
Yes, I think it's the while we are if you see any questions, let me know, Shannon. Till then, I think there is a couple of things I wanted to bring it up, as Maria mentioned about her honeybee example. We had a facility where they would start their shift with 5 paper clips, right? So they would start their shift with the 5 paper clips, and if they see somebody without performing hand hygiene, they would not say anything. So then they would just pass on that paper clip to the staff who did not perform the hand hygiene. So now the person, so you're killing 2 birds, right? So you're encouraging your staff to engage to be part of that your adherence monitoring, right? So then you're helping them to, and then also check upon each other. So also challenging without shouting out to, hey, you did not perform hand hygiene. So end of the day, so everybody, oh, I don't want to have 6 paper clips. I want to make sure that I keep either my 5 paper clips or to less than 5 paper clips, right? So then that was kind of, they had done that. And personally, what my own experience is, I had, if I took a positive note instead of taking it as a negative way of reminding staff on hand hygiene practice, what I did was I had, if I observed 10 observation that they had done a good hand hygiene, so then they would get it could be not on the same day, it could be multiple days. If I seen that individual had done a 10 good hand hygiene practice, so then I would give them the ice cream bar ticket. So then they would take it to our cafeteria and to get their ice cream bar. So it was so well received by the staff. Even my physicians would stop by and then say, they would, if I'm in the hallway, if I'm in the unit, they would say, Shantala, I did my hand hygiene. Where is my ice cream coupon? I said, no, it's only one. I need to see 10, right? So it was kind of like it was, we always had to think, even though we are all adults, we all have child in our heart, right? So then how do you engage? As Maria said, be creative in how to, especially the staff who doesn't like to listen to you. So you really need to ask them, so why? What is the reason? Is it a language barrier? Is it something, the cultural barrier, right? It's something, is there anything else? Is there any issues with their coworker, or is there any issues with their resident themselves or the resident's family, right? Sometimes they don't get along, how much ever they try, right? So then it's what's happening there. So how do we create an environment where it is safe for the staff as well as safe for the family members and the resident? So as Maria said, as you had to engage, and I know Yen from Danuba, I worked with them they have a memory care unit in their building. How do you deal with the memory care patients? How do you deal that the CNAs working with the memory care unit is totally different? How do you help them out? So the same practice, what you're going to be in a general unit might not be feasible, right? Whether it is a PPE practice or whatever the practice is, so they don't have an easy access to hand sanitizer. So how do you manage? So things like that. So you really need to look at what's how work, not just when you're creating your education program, not just for in general, versus focus on different groups and different population in your building, and come up with your your CNA program, or it's not just a CNA program, it's more of an infection prevention and control program to prevent any infection in your facility. With that, Maria, is there anything you want to add?
No, I mean, basically that's it. It's, you know, we've gotten staff has kind of worn out on that, and that's why innovation and new, you know, fun things to do are what we really need to do. And not only that, remind them every day that they're important. Thank them for what they're doing. I don't think they hear it enough. I do it all the time. I thank my IPs and I tell them they're part of my team.